Gynecology in Turkey is highly sought after and in high demand by foreigners in need of medical care. Women deliberately go to Turkey to take advantage of the high-quality services of local gynecologists at affordable prices. Couples with fertility problems adjust their plans and schedules to undergo artificial insemination in Turkey and give birth to a child here. Video about a specific gynecology procedure, removal of uterine fibroids, meeting a successful doctor in Antalya, Turkey. Subscribe to the channel and ask questions in the comments. Here is everything about medicine and treatment in Turkey. High-quality gynecological procedures, low prices, and the opportunity to combine treatment with relaxation in a pleasant climate. That's what attracts foreign patients to Turkey. To tell you about gynecology in Turkey, I met a doctor who has been treating women from other countries for many years.
Professor Işıl Kölelı, obstetrician-gynecologist with more than 20 years of experience, graduated from Ankara University. She has worked in a maternity and private hospitals in Istanbul, 2 years in a urogynecology clinic in Dortmund, Germany, taught at the Department of Urogynecology and Reconstructive Pelvic Surgery at İnönü University, author of an articles in serious international medical journals, opened an outpatient clinic in Antalya Education and Research Hospital, performs surgeries in ISO and JCI accredited international hospitals in Antalya, and sees patients in her own clinic, where she met me.
One of the challenges you aid your patients in overcoming is the condition known as uterine fibroids. Please provide details on how often this ailment occurs and the potential consequences it can lead to in women, if you may. Fibroids or myomas are found in about 25% of women who are 40 years old or older, occurring in every fourth woman. Fibroids have the potential to cause pain in the pelvic area, discomfort during sexual intercourse, heavy menstrual bleeding, or irregular bleeding episodes that deviate from the normal pattern. If fibroids grow excessively, they can exert pressure on the intestines and result in the occurrence of constipation. Fibroids can also hinder a woman from conceiving.
In simple terms, a fibroid is a benign tumor made up of muscle and connective tissue of the uterus. Per scientists, fibroids result from disrupted myometrial cell growth regulation, i.e., the muscular layer of the uterus.
Is it possible to eliminate uterine fibroids without surgery or any invasive procedures? Non-surgical methods of treating fibroids do exist, but they are not highly effective. For example, there is drug treatment for fibroids, but this medication has a very serious side effect in the form of osteoporosis, and after discontinuing the medication, the fibroid returns to its previous size. Therefore, we cannot use this method very often. Another non-surgical method of treating fibroids is the blocking of the blood vessels that supply the fibroids with a specially placed thrombus. Nevertheless, this can have an impact on the ovaries, leading to issues for females who are below the age of 45. Or there might be a potential risk of the clot migrating to other regions. Consequently, this technique has certain limitations. We can apply these treatment methods only to specific groups of patients. Therefore, in most cases, myoma is treated through surgery.
Tell me, how is the removal of fibroids done? How do you prepare the patient for surgery? What does a surgeon do? Tell me in detail. We have 3 types of surgical approaches to fibroids. If these formations are located inside the uterine cavity, we use hysteroscopy. We insert a camera into the uterus and simply remove the tumor. If the fibroid is located in the uterine wall or outside of it, then we remove the fibroid through an abdominal incision. We have 2 types of methods for this: closed method with laparoscopy and open method. When we remove the myoma using laparoscopy, we encounter the following risk. If cancer cells are in the fibroids, they can spread during surgery and pose a risk to the patient. Therefore, we have to remove the myoma in special bags. This may slightly increase the cost. With the open method, we enter the abdominal cavity through an incision, as in a cesarean section, and remove the fibroid. At the patient's request, we can also take out the uterus during the same operation. If the fibroid is of significant size, we proceed with its removal by performing an incision along the midline of the abdominal cavity in order to extract it effectively. How long is the recovery period after this operation? What stages does it consist of? During myoma removal operations, the patient usually stays in the hospital for 1 night, sometimes 2 nights. After 3 to 4 days, she is already able to travel. On the second day after the operation, patients can already walk and do everyday activities. After 3-4 days, they can return home. How and within what time frame do you monitor the success of treatment after surgery? The success probability of the operation is 100% as we promptly identify and eliminate the threat. However, prior to the patient's departure, we conduct another ultrasound to ensure that the fibroids have indeed been successfully removed.
From which countries do patients usually come to you? We reside in Antalya, and here the population that speaks Russian is in the tens of thousands, so a significant number of our patients are Russian-speaking. We also have patients from Germany, predominantly Turks living in Germany. Additionally, we have patients from England and Egypt, and there is a group of patients from Turkmenistan, Tajikistan, as well as Azerbaijan. Many patients from Dubai and Saudi Arabia. The population of Turkey is large, and doctors see many patients, so we have a lot of experience in the field of healthcare. Our hospitals are typically high quality, offering excellent treatment opportunities and professional development for doctors. The video description includes procedure cost, reception, airport pickup, hotel accommodation, and language-speaking assistance. Turkey stands out from other countries with its comprehensive approach to patient care, where each procedure has to be paid for separately. The company Healthy Turkey, which works only with verified specialists in both medicine and hospitality, is responsible for organizing such an all-inclusive trip and coordinates all their work for each patient. Healthy Turkey takes care of everything, from consultation and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents, and even rest between doctor's appointments. The company's website address is on the screen. This site has a lot of information on other areas of health tourism. You can use it as a reference. Contact this number for consultation. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.